السلام عليكم دكتورة سارة. دكتورة سارة.
Oh, I was muted.
انت عارفة كنت muted all the time, so
Okay, let me start from the beginning.
من الbeginning. So
Yeah.
خليني أدي مقدمة بسيطة. أول حاجة, I would like to welcome all the participants who joined us today. We are grateful to have Dr. Sarah Ahmed, the director of hospitalist program at Yuma University. She is American board certified in internal medicine, and she worked as a hospitalist since 2011. She's not far from teaching. She works with and teaches family medicine residents in the inpatient rotations, and we are grateful to have her today to help all the ERAS applicants who are waiting to receive their interviews shortly. So Dr. Sarah is going to give us a presentation, and then we're going to open the questions for anyone who needs help or have any question. Welcome, Dr. Sarah, and thank you for being with us today.
Thank you, Ines. Actually, I introduced myself while I was muted, so thank you for this introduction. And hello, everyone. I see a couple of audience, maybe 6 or 7. I think we'll go ahead and start. And before I start, do we have any non-Arabic speakers in the audience? The reason I'm asking is, what's I would like to know what's the preferred language for the audience. Can I use Arabic at times, or should I just be strictly English, or what? If anybody can give me a hint. Okay. I will basically speak in English, but from time to time I might use an Arabic word, so pardon me if there is anybody who is non-Arabic speaker. First of all, today's lecture or presentation will be most likely the start of a series of meetings regarding the residency interview process. So I call this lecture pointers about residency interview. This means we'll just familiarize ourselves with the whole process of interviewing for the residency programs. The first question, I guess, we need to ask ourselves, why is it important? If I can ask Lena to mute herself, please. Yeah, thank you. Lena.
أنا لي نوب علي يا ماما. هؤلاء بس ليش هذي من وين؟
If you can mute yourself, please. Or do you want to say something? Do you want to tell me something?
Sorry. I forget to mute my microphone.
Okay, that's okay. Yeah. Thank you. So let's start familiarizing ourselves with this process. By the way, a lot of people come to the residency interview without any background knowledge. They just come and go into the interview without knowing any information or getting any form of preparation. I don't think this is wise. People really need to prepare. It's a very important milestone or step towards getting introduced into the healthcare system in America. Without residency, your chances are very slim to be a practicing physician in the US. It really doesn't matter how good or how well you did with your exams and your scores. If you don't do well with the interview process, you will have a poor chance to be accepted to a residency program. And in that case, the scores or the successes you made before are irrelevant. So it's as important as doing well in the exams. And to do well in any field in life, you really need to prepare. I know it's different for everybody. No two interviews are alike, and people have different experiences. They were asked different questions. But there is a general sense of what people can do to be prepared. And we'll try to go through this process together. Let me do this. Okay. So let's start by defining it. What is it? What is the residency interview? It's actually a very important step in selection and placement of medical graduates in residency programs. As I said, without going through this process, you cannot be accepted to a residency program. And without being accepted to a program, you cannot be qualified to work in the United States healthcare system. So what happens? Why? You submitted all these papers, all these certificates, your CV, your letters of recommendation, all this paperwork that you submitted through ERAS, and still they want to see you and talk to you. That's the question that people need to really answer. The answer to this question is they want to know you as a person. Yes, they have a lot of information about you, your successes, your scores, your professional experience, whatever you did, and the impression of other people about you through letters of recommendations and all this stuff, but they don't know you as a person. So the interview process is not about your professional achievements. That's not what they are looking for. They know once they offered you the chance to come and interview with them, this means they like what they saw in the paper. The papers you submitted are actually were good enough for them. You have good scores, you have good experience, you did the observerships, you did internships, so they like that. But they want to talk to you in person to assess you as a person. You see? So it's not about your medical knowledge when it comes to interviews, it's more than that. It's more than that. So they somebody has a question? No? Okay. So the things that they are looking for maybe can be grouped under 4 groups. Interpersonal skills, and we'll talk more about this. What does it mean to have good interpersonal skills? Clinical knowledge, of course, we cannot underestimate that. They still want you to be a good, knowledgeable doctor. Professionalism. This means your conduct within the professional setting. That's the meaning of professionalism. Are you professional or just a haphazard person? And they want to check whether you are compatible with their program and with their program goals. So these are the things that they want to see when they are interviewing you. The things that cannot be written in paper, the things that they can judge by looking at you. Okay, So the process overall can be divided into a couple of steps. First of all, you finished or completed your application process through ERAS, and everything is fine. You satisfied that part. The programs now start sifting through these applications. And the first step for you is you need to get an invitation from the program saying, oh, we are inviting you to come and go through the interview process with our program. So the invitation is the first step. Once you got that, you need to work on scheduling the date for the interview. It can be a negotiation between you and the program to see what time is good for you, what date is good for you. So scheduling is the next step. Then the decision is to what format. The format of the interview is whether it's in person, you need to actually travel and go to the program location in person, or it's virtual, like through Zoom, Skype, phone, whatever. So the format of the program needs to be decided as well. They might tell you in the invitation that we conduct our interviews through Zoom, for example, or we want you to come in person. They might, but this needs to be one of the steps to decide. Then it comes to the interview day, which is the big day. The interview day has to be managed in a certain way to be successful. And within that day, of course, when you meet the panel or the faculty, the program director with the faculty, they have a couple of questions that they want to ask you, trying to extract information about you as a person. After you are done with all this, then there is the follow-up. The follow-up actually includes that you need to make an effort to send a thank you note through an email, most likely, to the program. And I would say this thank you note is the polite thing to do. It's part of the etiquette after doing interviews. The thank you note, make it a step that's stable in your management of the interview process. No matter how you did, even if you think you did poorly and they will not take you, still send a thank you note. Let me tell you one reason why. When you are courteous and following etiquette and you are polite, you might get a chance with them. How? Sometimes people interview to a couple of programs and they are actually accepted in a number of programs. And of course, they will end up getting only one residency program. So all the rest will be declined. And the programs actually have a list of possible candidates. So you have the actual list and a waiting list. You might be part of that waiting list. And if somebody declined the offer and kind of apologized and said, I'm not coming to your program, you might be next in line. So they will look into these small steps, small things. He is polite. He sent a thank you note. He showed us that he has manners, basically. So make it a point that when you are done with an interview process, thank them through an email. Just make it a point. Okay, now, generally, I like to group things into big groups so that I can manage them easier. The interview process, let's group whatever happens within it into 3 groups or 3 categories. The first category is yours. You are the interviewee, the person who is being interviewed. You are one category. Then the place of the interview, which program, which city, which state, whatever, we call it the venue. Then the third category is the people who are interviewing you, the program director, the panel of the interviewers, the faculty, whatever it is. This is the third category. Each of these three categories has its own factors that needs to be managed, certain things that you need to know about and how to deal with them. But the focus will be throughout this talk and maybe the subsequent talks is the focus will be on you. Why? Because you are the most important category in this whole process. You are important because your career might depend on it. You are the one who is going to manage it. You are the one who is responsible for making it successful. Having a successful interview depends totally on you. It's not because the program director is not a nice person. It's not because they are racist against you. All these things, by the way, were said before. When people are trying to find excuses to the fact that they were not successful in doing their interview, they would start finding things about other people or other things. Avoid doing that, please. Take the responsibility of making your interview process successful. You are the one who can do it or make it successful. Take that responsibility. This is my recommendation to everyone. All the work that's needed, all the preparations, all the rehearsals, or whatever, it's your responsibility. Forget about the other factors. Forget about the place. Forget about the people. I think there is please try to mute yourselves as much as possible. It's distracting to other people. Okay, so let's agree on this part. You are the most important factor in this interview process, and it's your responsibility to make it successful. Okay. Now, how can we make it successful, or what is successful interview? When can I consider my interview successful? When you are offered a position. When you get that when you are offered a position with that specific program, when they send you that email that's saying, congratulations, you have been selected as a potential or a future resident with our program, this is a successful interview. So that's the definition of success. So far, we agreed upon you are the most important person in the interview process. It's your responsibility to make it successful, and successful interview is when you are offered a position. These 3 points are very important, by the way. Not everybody understands these 3 points. And if you do understand them well from the beginning, they will be crucial in your future performance. Okay. Let's see. I'm sorry, sometimes. Yes, okay. So why, as I mentioned earlier, you submitted a lot of paperwork, a lot of information about yourself, your CV, letters of recommendation, everything. Why do they want to see you? Why do they want to talk to you? What's the purpose behind this? The purpose is they want to assess a couple of things, and I group them under 4 categories. It might be a little, they want to see more of that, but I put them under 4 categories. Interpersonal skills, communication abilities, critical thinking abilities, and the last one is enthusiasm and energy. Let's go back to the previous slide. The interpersonal skills, meaning your ability to deal with other people, basically. Are you a good communicator? Can you collaborate well with other people and share your knowledge, share your information? Are you polite? Are you friendly? Are you adaptable? Meaning adversity can help you grow rather than devastate you. Are you respectful? Are you cognizant to cultural differences? What kind of interpersonal skills do you possess? That part is key, by the way. Key. Some people are excellent, shining in paper. They have all kinds of observerships. They did all kinds of research. Their numbers are glowing. They have very good resumes, and they got the best letters of recommendations. They did everything well. But when they come to the interview, they are arrogant, they are disrespectful, they don't know how to communicate well, they are lacking confidence. These things can be a reason for them to be rejected, by the way. These skills and competencies are essential. Nowadays, in every industry, by the way, it's not just healthcare. People are looking for these interpersonal skills. They are looking for people that can actually talk to other people. They have respect. They can communicate and collaborate. They can teach other people and educate them. They have ability to manage conflict. And they don't go into a lot of conflicts as well. They make people comfortable, make people around them comfortable, meaning they are not awkward people. They are not awkward, meaning they don't increase the tension in the environment. The environment is friendly. They are easygoing. They are lovely people, basically. So anything that you want to see in a friend or somebody that you live with or something is considered a good interpersonal skill. I cannot stress more that these are the keys now. These program directors and the faculty or panel that's interviewing you, they are looking for these things. And that's, by the way, these are one of the reasons that people actually are amazed. Oh, how can they refuse me when I have all these achievements? How can they refuse me when I have all these scores? They refused you or declined.
It's closer. You want to change it? Okay, so how it's organized. You want to change the band.
Excuse me.
ما انت خالد صلح البان كويس.
Excuse me, please try to mute yourselves.
What I promise.
Dr. Khulud, can you please mute yourself? Thank you.
Okay, thank you, Khulud. So please try to rehearse and practice these skills. And I think as we go forward with these lectures, we can talk more about them. So it's your interpersonal skills, communication abilities, critical thinking abilities, enthusiasm and energy. Let me stop here for a minute. When you go to an interview and you are talking to the panel, try to be positive in your answers, first of all. When you talk with some enthusiasm, especially if you are mentioning anything about the program itself. For example, people can say, if I was accepted within your program, I will be proud to be able to work with such a great cardiology department. I heard about it, I read about it, it's really great. I would like to be part of this. You see, you talk to them, you tell them that they are good. You tell them that they have great departments. They are doing a good job. And as you talk, try to convey a positive energy that's really, it kind of light up the room. People want to hear these things. If you know human nature, people don't like to hear negative things. And don't be dull. Try to be enthusiastic. Try to be energetic. Try to be positive when you answer any question. Any question. It doesn't have to be a specific question. Try to tell them that they are good. Yeah, you really is looking forward to be part of the program, their program, because their program is great. And you can pick up here and there some things about the program that are positive or famous. If you didn't know about the program, try to talk positively about the city or the town the program is in. Your town has great schools for my children. I would like to be part of this community, which is anything. So that's what I mean by enthusiasm and energy. So you give this coat of enthusiasm and energy to your answers. Okay, whatever the answer is, whatever the question is. So please remember that. Don't be monotonous in your answers. Don't answer like a robot. Try to give it life when you answer any question. And these things give or tell us a lot about you. Okay, I mentioned earlier the format of the interview. It could be the traditional interview that they ask you to come in person, and it could be one-on-one, like one interviewer, but this is less likely. Usually there is a panel of interviewers that will talk to you. And nowadays we have this virtual choice. Meaning through a Zoom, through the phone, or any other means. You don't have to travel to that location. These are other formats that are available, but I don't think they are using them much. Like having a group interviews or multiple mini interviews, meaning they ask you for the first interview followed by another follow-up interview, which is really cumbersome given the number of applicants. So the most likely formats will be either the traditional in-person one or the virtual one. Now, as I mentioned, you are the most important person in this process. It's your responsibility to make it successful. And successful means this program who offered you the interview actually will end up offering you a position. This is success. Now, to make it successful, you will not leave it to chance. No, that's not the way to do it. To go blindly, just depend on luck or something like that, no. It doesn't work like that. You have to prepare. You have to really prepare for this process. And remember, landing a position in these residency programs is becoming very competitive, especially for IMGs. Especially for IMGs. You are not given priority in a lot of programs. They give priority to American graduates or graduates of American medical schools. The international graduates are not a priority, and they don't get a lot of interviews, by the way. Let me tell you about what happened to me. I did my exams. Of course, I'm an IMG. I did my exams while I was in Saudi Arabia. I did my step 1, step 2, and even the CS. I traveled and did it here and went back. So I applied, and I did my step 3 before applying. By the way, doing step 3 before the application or before the application increases your chances, by the way. It increases your chances of being accepted and increases your chances of getting a good, if you are looking for a visa, the visa can be a better choice, H-1B. Going back to my experience here, I scored at that time when I did my exam, the scoring system was based on the percentile. So my scores were actually great. I did 97 percentile in the step 1, 99 percentile in step 2, and I did 95th percentile in step 3. And I passed my CS from the first try. So in paper, I did great. And not too many people have these kinds of scores. But I was offered 2 interviews. I applied for a lot, but I was offered only 2 interviews. So the number of interviews that you will be offered can be really a small number. And you really need to make use of this small number to be able to land a residency program or a residency position. So what I'm trying to say is you need more than the American graduate to prepare. Okay, so what does preparation entail? What does it mean to prepare? First of all, when you are offered an interview, you need to do some research about that program which offered you an interview. And the research can be done, first of all, go in the online and look for their website, look for their performance in general, look for the city they are in, all this information that you can get from their online about them. If they have any reviews, any graduates of that program that put reviews or comments about the program, anything that you can find about the program, know it. This is part of your research. The other thing is you can contact people that you might know that graduated from that program to have a feel about what kind of questions they ask during their interview process. Because this process is different from one person to another and from one program to another. Okay, some programs, these are mostly the university programs that take only 4 or 5 per year, very sophisticated, very small. They look for new graduates and mostly American graduates. They are not IMG friendly. So these will be asking questions, the style of your interpersonal skills, your communication skills, some maybe medical knowledge, stuff like that. Some programs, especially the large ones that they take 20 to 30 residents a year, and they are in areas which are not like big community hospital or some crowded areas. They would like you to have experience, medical experience. They don't like having new graduates because their style of teaching or the style of conducting their program is that in the way that they depend on your performance to run the hospital. And this happened to me. That's the program I was there in. It's a community hospital in Brooklyn, New York. We were 30 residents per year. So the whole program has 90 residents. This is a huge program. The hospital was very busy hospital, and they relied on us to run the hospital, basically. The attendings, we see them during the rounds in the morning, and afterwards we just contact them through the phone. They don't even bother to come. We run the whole night on our own, stuff like that. So these people, this kind of program, they want people with experience, not new graduates that they know nothing about the practice of medicine. No, they are looking for people who are older, more experienced, and knowledgeable, basically. Okay, so it matters what kind of program it is, what kind of questioning it is, all these things. Do your research. Other preparations is the appearance, and I can't stress this more. People need to have garments that are ready for the interview. You try to get some formal looking garments that you can use during your interview process. One or two. Of course, you can buy one and use it everywhere. That's fine. You don't have to have different sets. One set that's formal, that's professional looking, use it wherever you go. That's fine, in whatever program. But appearance is necessary. Appearance is necessary. Please avoid things like too much jewelry, too much perfume, dresses that are funky, basically. Try to be professional looking. Carry a bag that's professional looking as well, as much as you can. And don't come unkempt and not really. For guys, have a suit. Get a suit that's for these kind of interviews. Of course, cleanliness and all these things are out of the question. The logistics part. Logistics means how are you going to plan your day, basically. You need to travel. If you need to travel, you need to make arrangements. Where, how to get to the program itself from your location. And when you get there, where are you going to eat? What are you going to wear? And what kind of transportation? All these things. You need to have a clear plan in steps. 1, 2, 3, 4. This is how I'm going to manage my interview day. Logistics, very important. You need to know it. Don't leave anything for chance or surprise. Punctuality. Oh, that's if you come late to an interview, that's a big red flag. Big red flag that you can't make it to the interview. The most important step in your career, maybe you can't make it in time. That's terrible. And of course, you are not going to provide excuses. Oh, I'm late because the taxi driver was whatever, or no. You have to be punctual. They asked you to come at 7:30 in the morning. Please be there at 7:25 in the morning. Please. As I said, it's your responsibility. Don't blame any outside factors. That's not acceptable. And the last part about preparation is the practice of the common questions. And this is the biggest part, maybe, biggest part about this whole process. I'm not going into details in these things. I'm just orienting you because this is kind of an orientation lecture. Now, yeah, the language. If anybody thinks that their English language is poor, please, please, please work on improving your language. This is the language of the interview, the language of the subsequent practice. you will practice in English, basically, most of the time. Some areas Spanish, but mostly English. So sit with yourself, assess your level of proficiency in terms of English speaking or writing or all aspects of the language. See where you stand. If it's poor or basic, you need to improve it, really. And nowadays, things are available. You can actually do it online. You can join an online course to improve your language. And there are all kinds of courses that either beginners, medium, or in the middle, or experts. You can improve it at all levels. So start by assessing your level and then plan accordingly. But you have to work on improving your language. That's very important. And this, by the way, can be one of the things they look for. How good is your language? They want to make sure that you are able to communicate with patients, are able to participate in the learning process efficiently. They want to make sure that you are able to communicate well in English. So make an effort to improve that. And this is vital, actually. This is very important. So this is one of the things that you can do to improve your chances. Okay, now let's talk about this part. What is personal narrative? Building your personal narrative. Personal narrative means what can you tell me about yourself? That's how can you present yourself? How can you talk about yourself? That's called personal narrative. And this is a very big question. And actually, this will be the focus of one of the lectures, at least, if not more. And by the end of this lecture, I will give everyone that's here a homework to do within this area. But basically, the things about you that they would like to see or hear about are, what are your strengths? Why did you go into medicine? Describe any volunteer work that you did. Describe problems with the healthcare system in your home country. Tell me about meaningful relationships in your life. Is it family? Is it a spouse? Is it friends? What is it? These are just examples of personal narratives. There is a list of maybe 100 things that you can talk about, but this question of tell me about yourself, or what can you tell me about yourself, is one of the most important and prevalent questions that you can be asked. And as I said, it needs attention, more attention than this. Okay, part of this interview process could be about, they give you a scenario and they would like to know how you are going to deal with that scenario. This scenario could be a clinical scenario. Somebody came with chest pain to the ED and they described the pain as so and so. What do you think? This is a scenario. It could be some ethical scenario. Things like how to talk to families and patients about bad news, how you break that, dealing with colleagues and dealing with conflict, things like that. Scenarios that they would like to hear your opinion or your response to. Some of the things that you would like to kind of squeeze into your answer is to show some of the qualities that are good qualities that they look for. For example, they would like to know that you are a compassionate guy, you have compassion, you have patience, you can relate to other people in an empathetic way, you have good communication skills, and you are humble. And I cannot stress more, humility is a very good quality. Don't be or show others that you are arrogant or full of yourself. That's a terrible, terrible quality to have. Some people come from their home countries after practicing medicine for a long time. They have very good experience. They have a lot of certificates, and they made a name for themselves. They made a name for themselves back home. But now they are planning to come here to join the American healthcare system. And as such, they need to go through residency. Okay. These people, if they came with the idea that I know more than even the panel that's interviewing me, I'm knowledgeable, I'm big, and this shows in their behavior, this is terrible, this is bad. Because what they want to see is somebody who can accept education. You are going into an educational process. You are not the teacher here. I don't care. I mean, I might care about your experience, but as a resident, you have to do whatever other residents are doing, the ones who graduated yesterday or the ones who has experience like yourself. But everybody has to go through this education process equally. So I don't really care about how you spend the last 20 years of your life. You are here to learn, and to learn, you need to be humble. You need to accept all the difficulties that other people will accept during their residency. And residency is a difficult time, by the way. It's really difficult, and it tests your patience. It tests your humility and all kind of things. So humility, be humble. Don't show people that you are better than them. That's a terrible quality to have. Okay. Some people ask, can they ask medical questions? Oh, definitely, yes. Absolutely, they can ask medical questions. My whole interview was medical. I don't remember they are asking me anything else. They just asked me scenarios, medical scenarios. Somebody with PE, somebody came with myocardial infarction, somebody has abdomen. These are the questions. So you need to be prepared to answer such questions. And by the way, again, don't leave it to chance. Don't leave answering these questions to chance. Be organized. You have to develop a method of answering questions. Meaning, you go through headings. If they ask you about chest pain, try to go through what chest pain entails, definition, any further questions that you need to ask, and then what are the important parts or important things that I need to make sure are not happening with somebody with chest pain. With this particular scenario, is this chest pain cardiac or not? Stuff like that. And this thinking process should be accompanied by talking. When you are thinking, you talk to them. You are not thinking in your head, and the end of the thinking, you tell them, oh, this is myocardial infarction. That's not, what were you doing? Tell me, how did you reach that impression or that conclusion that this is myocardial infarction? Tell them that the chest pain qualities point towards cardiac. This patient has risk factors. He has diabetes, he has hypertension, he is obese, he is a smoker. So he has all the risk factors for coronary artery disease. And when he came, the pain was triggered by stress or whatever, and stuff like that. Talk as you think. So you have to have a way of organizing your thinking. Develop a system. Start by organizing for example, if they said chest pain, then talk about the chest pain a little bit. Say, oh, this chest pain with these qualities, it's central, it's crushing, it's radiating to the neck or to the arm, and it's associated with so and so. this points towards cardiac chest pain, and this patient has risk factors that are talk as you explain, and that's what they want to see. They don't want the conclusion or the diagnosis. This is not an exam. They want to see how you think, what's your critical thinking process is. Understand? They want to see this. They don't want to see the diagnosis. They don't care. Even if you got it wrong, after telling them this in an organized way, even if you got the diagnosis wrong, they don't care. You went through the process well. That's what I want to see. Okay. Now, people, if you were offered 5 interviews, you were one of the lucky ones who got at least 5 interviews. And these are different programs, different panels, different people asking you questions. Can I use my standard answers in different interviews? Yes, absolutely. Try to have a general sense of how to answer. Tell me about yourself. You have a specific scenario, specific answer that you rehearsed and you practiced and you know it. You can use it every single time. It doesn't matter. They are not going to tell each other that Mrs. X or Mr. X, when he came to us and we asked him the question about themselves, they answered it this way. Nobody talked. They don't talk to each other like that. So it doesn't matter how many programs or how many times you use it, it's acceptable. Familiarize yourself. Inas, you want to say something? No? Okay. Familiarize yourself with a specific answer and practice it well, know it well, and use it as many times as you would like. The time is running, but let me go quickly through this. Okay. I, again, will tell you, show interest in the program. Show interest in the program. Research it. Know their strengths and weaknesses. Know their highlights, because each program is proud of something. They are proud of being in a great city or a great location. They are proud of having very good specialty programs that are working together with them. They are proud of something. Know that's something and try to highlight it as you talk to them. Remember the energy and enthusiasm. This is important. Okay, now we reached the actually final slide. I would like, if people want to continue doing these sessions with me, I don't know how I did, so you will tell me in a minute. I would like, if anybody is coming back to the next session, to do this homework. I would like you to provide an answer to the question, what can you tell me about yourself? And write it down in a piece of paper. It can be half a page or something. Don't make it long. It should be within 2 minutes or so. So it should be short and sweet, to the point, meaning. The next time we meet, I would like everyone to answer that question, the one that they rehearsed and they actually written down. And I would like to see some confidence behind answering it. Confidence is something that you really need to work on. Don't be hesitant. Don't speak in a what's again is opposite of loud. A soft voice. Be clear when you talk. Look them in the eye and show confidence. Choose some aspects of yourself and past experiences to highlight your strengths. Show qualities like compassion, collaboration, overcoming adversity. And one of the things that you might want to show is, why did you choose medicine as a profession? And people can get some story behind this, some personal story that pushed you to think about medicine as a profession? As I told you, when you perfect this part, you can use it everywhere, wherever you are asked to come and interview. Be organized. Don't rant, meaning don't just talk gibberish. Be to the point. And you need to rehearse. You really need to rehearse and practice what you have written. Okay, now, before we end this, if anybody has a question, and I would like to hear your opinion about this way of presentation, because this is the first time for me to do this. Anybody?
Thank you, Dr. Sarah. Thank you so much. Dr. Muhammad Sati has a question about here. He said, when I receive interview invitation, should I send an email to thank the program?
You need to respond yes. Yes, of course. Anything that will show that you are a good, polite, and good, polite person, and you know the etiquette is good. Yes, you need to respond by saying thank you for offering me the chance to interview for a position in your esteemed program. And yeah, thank you. I thank them and respond, of course, by saying I accepted your invitation.
And we have another question. What else can I do besides step 3 to improve the chance of getting into a residency program?
Okay, there are things that can help increase the chances. Step 3 is one of them. Having any kind of experience with the American health system, meaning if you did an observership, if you join internship, or whatever, these are good. This means you kind of now becoming familiar with the healthcare system. It's better than somebody without any of these things. And I think that's one of the things that actually hurt me when I applied, because I didn't have any kind of connection with the American health system. As I told you, I was coming from Saudi Arabia, where I was working, to do the exam and coming and go back. So it wasn't really, I didn't have a chance. So having any observership or internship, doing step 3, doing research, having extra certificates like MRCP, ERCP, MRCPs, any kind of public health, all these things, they look at it. It's not the most important, but it can tip the balance towards you. Okay, any other questions?
I don't see any other questions, but I just want to thank all the participants for attending our lecture today, and all the thanks to Dr. Sarah for providing us with those very important information about the residency interview process. As I typed in the chat, we're arranging for a interview workshop with Dr. Sarah and maybe other program directors to help you guys. So if you are interested in being part of this, please join our Telegram group. We post the time and our advertisements and flyers there. Let me check again to see if we have any question. And feel free to unmute yourself if you have any question, or if you want to thank Dr. Sarah.
Yes, please, talk to me. I would like to talk to people. Talk to me, please.
Yeah, I have a question, if you don't mind.
Yes, go ahead.
Yeah, my name is Osama, and first of all, thank you so much, Dr. Sarah. This is really great, and this is so beneficial. And yeah, please provide us with these tutorials or these lectures. We really need it. Thank you so much again. And my question, my question is, some programs they are providing no data in the like eras or in internet and the Explorer or Frida. So and they send sometime interviews. Is it okay if we can contact them through the like LinkedIn or any like professional social account like this? Because some programs they provide no telephone number, no email, and sometimes the email doesn't work, and sometimes even the link to the website is inactive. I noticed that.
What kind of program is this?
Yeah.
Okay. They need to, if they are really part of this residency application process, they really need to have credible contact information. They can't just not have it. But yeah, whatever way you have available, try to contact them, at least to provide you with good contact information. Where can I call you, or how can I, or what email is good that I can use for my communication with you? And I would say when they offer you the interview, it's through email most likely. Nowadays nobody sends a letter. So this email, you can use it to try to obtain more contact information about the program. And when you are trying to know more about the program, don't contact the secretary who sent you the letter or the program director. No, contact the residents who graduated from there or they are there. These are the ones who will tell you more about the program and how the culture is within the workplace. I hope that was useful to you, Osama.
Yeah, it is. Thank you so much, Dr. Sarah.
Thank you.
Hi, Dr. Sarah, and thank you so much for the session. It was really great.
Thank you.
And we appreciated your effort and your help. I have a question. You said that one of the possibilities that you can be like in a waiting list after the interview. Is this the case also when offering an interview? So sometimes any programs can give you like an interview and you will be in a waiting list instead of you can schedule directly when you receive the invitation?
No. Usually they sift through the applications. And by the way, anybody who is offered an interview, this means they saw something they like about your application. You see, your experience, your something that they liked about you. That's why they offered you an interview. The interview is, everybody is offered an interview, the ones they selected, but when they come back and rank who is best and who is less and less, they have, for example, let's say 15 chances to offer. They will give the top 15 performance the chance. Some of these 15 people will decline, as I said, because they have other chances to get better position somewhere else, or they like another program, so they kind of decline the offer. Then they will go to their wait list, and even the wait list is ranked 1, 2, 3. So the top of the list will get that chance and stuff like that. That's how it works.
Hello, Dr. Sarah, I have a question.
Yes, go ahead.
This session is very great to me, I think for everyone even. And is it okay to go and meet the program coordinator, the program which is newly started? They are going to, this is the first time they are established as the internal medicine program. Is it okay to go and meet the relevant the program coordinator and talk to her?
It's very, yeah, of course. You go with the intention about knowing what are their expectations on the day of the interview. Introduce yourself. I was offered an interview with your program, so I would like to know how to manage my interview day, and I'm here to introduce myself and know more about what to expect or what to do. Yeah, of course, it's acceptable.
Okay.
It's actually good. It's good.
Yeah. Yeah, it is walking distance hospital from my apartment.
Oh, you
Yeah.
are lucky. You need
Thank you,
to you need to work hard to get that chance. Work hard.
Yeah, I went several times. Ma'am, I went several times, but I couldn't meet anyone. But I tried my best to go and talk to them again and again.
Good luck.
Thank you.
Yeah, okay.
So, Dr. Sarah, in the same for the same scenario, but still didn't get an invitation from them, but the hospital is close to me. Is it recommended that I can go and talk to them before sending an invitation, or just wait?
What do you mean sending an invitation?
I mean, I didn't receive an interview invitation from them. I applied to them. So is it recommended to show up or just wait and see?
Not really, but if you have somebody that can actually recommend you, part of their faculty, part of the staff, somebody they know, that will be a better choice. I don't think they will offer you an interview because you came to them. That's less likely.
Okay, thank you.
Yeah, but if you have somebody that can vouch for you, they might make an exception and say, okay, yeah, let her come for an interview. They might give you a chance, yes.
Salam, Dr. Sarah. Thank you so much for the informative session. I have a question, please. I received an interview for a program I'm really highly interested in, but I didn't send that thank you email that you talked about. So I was wondering if there's anything to correct that. And the second question I have is, I scheduled the interview really late just to have the best preparation I can have. But I read that this is perceived in a bad way from programs. So I wonder if you have any thoughts regarding that.
They already started giving interviews, sending interviews. That's, yeah, okay. Did you respond by accepting the invitation? Did you respond? You sent an email saying, yes, I accept?
It was through an application called Thalamus. So you just go in and you accept and you like decide which date. But I didn't respond in an email. I didn't get an email, a direct email from them. It was through an application.
So that's a different process. Yeah, no problem. You know, these small things, they will not really devastate the result. It's just they are nice gestures. And as I said, people sometimes in some extreme situations, they come back to these kind of behaviors and look at it. Oh, look at this. She sent us this email and look at this, stuff like that. But it's really not that devastating. Don't worry about it. If you can still send it, say, thank you for offering me this. And I would like, I'm looking forward for the interview process. And I hope that I can be part of your residency program in the future if I was successful and stuff like that. Yeah, you can still do it. That's okay.
We have some questions here, Dr. Sarah. So there is a question about what things to include when answering. Tell me about yourself question. I think that's a slide.
Yeah, this is one of the most important and most asked questions in the interview process. Actually, we will kind of dedicate a whole presentation to it in the future. I don't know whether it's the next one. It should be the next one because I gave you that homework. You know, this question, there are so many things, so many parts of your personal and professional life that you can include here. You can include things like about you personally. What are your hobbies? What are your interests, your strengths? What do you like and you dislike? You can tell a story about some experience, like a bad experience or something happened to you and how you overcome that part or adversity. You can talk about your family, you can talk about your medical career or medical education, and especially if you had some difficulty with it, but you managed to succeed eventually, things like that. The idea is, whatever you talk about, try through that talk is to show good things about your character, your personality. that you are confident, you are resilient, meaning if you had some adversity happen to you, for example, in Sudan, I would say having this war could be an adversity that people would respect if we learn something from it. We learned that the healthcare system should be priority for whatever. We learned it's something that you can put together, including the war as a major adversity that impacted your country, and what did you learn out of it, for example. Something that they can listen to you as you are talking and show that you are actually a growth mind person, meaning you are not somebody who is a victim or somebody who blames others. So these bad traits. You are somebody who learns from mistakes and learns from adversity and grows and continues to succeed and continues to learn, stuff like that. So the general approach to these kind of answers should be a positive approach, something that shows your strengths, shows that you are somebody who is willing to do whatever it takes to succeed and whatever it takes to help their patients and stuff like that. This should be the general approach. And we have to talk more about it, really, the details of it.
We have a related question. So is it wise to mention my kids in talk about yourself question?
Yeah, it could be. But as I said, don't just mention them for the sake of mentioning. Mention them because they contributed to something to your character, contributed something to your professional growth, something like that. But don't just mention it to define yourself. Oh, I'm a mother of 3, and you stop talking. No, it shouldn't be that way. It should be to show something good about your character. I'm a mother and I have 3 kids. They are close in age. They are all young, and they kept me busy. But despite that, I was able to do prepare for my exams, and I got مثلا good scores, and I was able to stay connected with the healthcare system by volunteering or doing observership or internship, stuff like that, especially if you have gaps in your experience. Despite
that's another question related to this. So how can I deal with gaps if I have a gap for more than an year? So it could be related to the question that you were answering. I'm sorry I interrupted you.
No, that's great. Actually, the gap question is an important question. The gaps are not favorable. They don't like it. But what you want to do when you have gaps, and some people have a lot of years as a gap, you need to show that you were not totally out or away from the healthcare system. Yes, you were you were not working officially as a physician.
Recording in progress.
But you actually were connected by doing volunteer work, by doing observership, by participating in fairs, participating in something related to medicine. And some people can try to justify the gap time by telling a story about caring for a loved one who was sick, for example, or having some issue in their life that kept them behind. What they don't want to see is you sitting there doing nothing, and now you just came and decided to go back into healthcare. That they don't want to see. But try to justify it in a way that there is something compelling happened to you during that time, and you needed to really give it a priority in your life. But despite that, I was connected to the healthcare system by whatever way, doing research, doing this and doing that. Yeah, the kids could come into that, actually.
I have always told my colleagues that it's okay to have gaps in the resume, not so too long gaps, as long as you're having a child or you're taking care of your kids. But that shouldn't be an excuse for all the gaps that you have. You can still say, oh, I was, preparing for my exams. I was studying for the exam, and at the same time I have a little kid that I was taking care of. Oh, I came to this country and I just gave myself some time just to adjust to the country and know more about the lifestyle here and help my family to get through this. So that's
a great answer, actually. That's a great answer. Yes. And these are the human thing. This is life. This is how life works. Sometimes you give priority to something else because it's a priority, basically. I mean, people need time to do things.
So another question is, will interviews still be conducted virtually this season?
Some of them, they will. And some of them might give you actually a choice. Do you want to come in person, or you can do virtual? Yeah, I think it became a valid way of doing interviews.
And less expensive, of course.
Yeah, of course.
The traveling, the traveling expensive.
And by the way, just
the best, virtual or in person? Which is the best, virtual or in person?
Okay. Best how? Best. I mean, each has its advantage and disadvantage. Meaning, if you have too many interviews, let's say 10 or more, it might become difficult for you to travel to each of them. You see? So it might be better for you to do it virtually. But the virtual interview is still kind of hide something about you. You are not fully visible to who is interviewing you, by the way. That's could be an issue. For example, when somebody comes in person and sits in front of me, I can judge them better than somebody who is sitting behind a screen, where everything can be very sanitized, you can say. So each has its own advantage and a disadvantage, and I think we need to mention this in some of the talks as well, how to conduct this virtual interview or in-person interview.
For the candidate, which is better? I mean, it is not a financial matter or a matter of traveling or something like that. Just to increase my chance to getting the ranking, which is better?
The better is in person. The better is in person. I think they will look more favorable to somebody who actually took the time and made the effort to come in person.
Okay, thank you.
Thank you.
Okay, we have some comments here. Ira said they will continue doing interviews through virtual. And what's your advice to have any experience while I'm preparing myself for the exams? For example, you mentioned it's good to be observer or researcher. Can you explain it more?
Yes, usually the way people do observership or internship is to contact somebody they know, and this will arrange for them to come and spend some time, like shadowing a doctor or being involved in the rounding process and stuff like that for a specific amount of time, a month, 6 weeks, 2 weeks, it depends. So it's just, it's usually done that way.
We had a session before through our Telegram group about how to get a research position. And actually, we had Dr. Alina who got a research position through J1 visa at Mayo Clinic, Jacksonville, Florida. So we would see if she will be available maybe to conduct another session on this. We have a question here. If I have MPH, Masters of Public Health, can it help me to get chance in residency?
Yes. Actually, it's a very positive point to have that. Usually, look at it like that. They have candidates who did the exams, have whatever experience they do in terms of US experience, observership, internship, whatever. They are, if we have two candidates who have the same, and one of them have a public health certificate, that one will be better, of course. It can tip the scale to your advantage.
Another question
Dr.
here. Go
Yeah.
ahead.
Sorry, please apologize for me. And Dr. Sarah, I have a question. And I got secondary application from the one psychiatric research track program. And unfortunately, I submit 2 times. Is that fine?
You got what? I couldn't understand.
Secondary application from the one of psychiatric residency program, which is called the research track.
I'm not familiar with that. What is secondary application? What do you mean by secondary application?
This is my first time. I also don't have a big idea, but I submitted 2 times, and is that fine?
Yes. I mean, depending on how they answered you after the first application, what happened?
After first application, they send me the secondary application because they are interested.
Very good. So they like you.
Yeah.
They like you.
Thing is, Dr. Sarah, unfortunately, I submit 2 times because first time I had one mentor. After that, I realized, so I want to add this mentor also. After that, I had another mentor, and because of that, I submit in 2 times. Then I got I'm worried about that. Because of that, I asked from you.
No, I think what will end up happening is one of them will take you, and that's it. That's the end of it. I don't think that will decrease your chances. But the fact that they actually gave you a secondary application, this means they are interested in what you can offer. So I think it will be good.
Yeah, it is research and clinical based program, mainly
Very
research.
Good. Very good. Good luck with that.
Thank you, doctor.
Thank you.
Okay, so we have another question here. I'm not sure if you have addressed this already, but how long should your answer be?
Oh, for the homework, for the question of tell me about yourself, for example.
I'm not sure. Dr. Akram, if you're here and you'd like to speak, just unmute yourself.
He said yes.
Oh, okay. Okay.
Yeah, it should be around 2 to 2.5 minutes. Not very long. And usually, just remember, the panel that's interviewing you are humans. And humans don't like to listen to a long rant. They would like to hear some concise, to the point answers, and as short as possible. So 2 minutes, 2.5 minutes, something like that.
Okay, Dr. Khulud, if you want to go ahead and unmute yourself.
Yes, Dr. Sarah, thank you so much for that.
Welcome. Maybe she has a question. Khulud, do you have a question?
Yes, I have a question. Thank you so much, Dr. Sarah. This is a very nice and so helpful. And sorry for the noisy background. I have a question here. Yeah, I have a gap. It's maybe a long time. I was not in practice. Also, I came from Saudi Arabia. But I'm asking if working as a medical assistant is B count?
Yes.
It's positive?
Yes, that's a connection. You remember the connection to the healthcare system?
Okay.
That's a good connection, actually. Yeah,
Okay.
that
Thank
will
you.
help. Yeah.
Okay, another question here. Dr. Sarah, if I answer every question with example story from my medical experience, is that okay, or it will be too much?
Okay, now people need to be wise when they are formulating their answers. I would suggest one story per the whole response. Don't tell people a lot of stories. Just one story to highlight a quality about you. Understand? Do a story, and by the way, rehearse how to tell it. And don't invent a story as you are sitting in front of the interviewer. You need to know the story beforehand, and the story needs to be relevant in a way that it gives you or it highlights a strength about you. Something, one of the things that we talked about, compassion, response to adversity, humility, empathy, things like that, the things that they would like to see in you as a person. Yeah.
Okay, I will take our last question here. I will read it. Actually, does virtual observership carry a large benefit to do, as to mention in the interview? Because currently I'm not working.
What do you mean by virtual?
Virtual observership is sometimes you can do like telemedicine. You can attend through.
Okay. I mean, it's better than nothing, of course.
Something
Telemedicine is
started
now,
during COVID, I guess.
yeah, telemedicine is now considered a branch of or a method of practicing medicine that's utilized by a lot of people. So if you participated in a program like this, yeah, you can count. But people, these things are mentioned in the CV. They are not. I mean, if they ask you about the gap time, you can include it, of course. But the experiences, they know. They should know, because they know, they have your information in front of them. You submitted a CV that's having all these things delineated, right? I think I would guess they know about it. But if they ask you about the gap years, you can mention this. I was having difficult circumstances that did not allow me to go in person or be out of the house in person. Or during COVID, I was able to participate in this telemedicine program, and I really benefited from it, and it was useful to me and stuff like that. So it's a connection. As I said, we are looking for a connection to the healthcare, American healthcare system. And the other part about the gaps years, just show them you were concerned about the fact that you did not start working yet. You were restless. You were doing something. Yeah, that's what we want to show.
Excuse me.
Okay. Okay. This will be our last question, because we are way over our time, the 1 hour that.
Yeah. Okay. Let her go ahead and ask.
Yeah, go ahead. Go ahead, Doctora.
No, just I'm the one who asked about the virtual observership. I didn't do it yet, so I'm afraid, like, when they ask me what I'm currently doing. So I was searching my options to find something to do, because I'm in a place that I can't work in a clinical setting. So
Can you tell me why not?
I don't have the efficient experience to work as a GP. I'm in United Arab Emirates. So I graduated with my internship, but I don't have the enough experience here that's required to work here.
Okay. I mean, they usually don't ask about what you are currently doing. Currently doing is not. They usually want to see the past few years. What have you been doing? So I don't know. Do you have any way to do or to submit some volunteer work or something? I don't know. I mean, you can still do it, of course, this telemedicine, but they want to see this in your submitted application. Did you submit your application this year?
Yeah, I submitted. Just I didn't. I wasn't thinking about doing it, but when I'm started preparing for the interview, and many people said that they will ask you what are you currently doing. So I started thinking, should I do one or no?
I don't think it will hurt, of course. Do it. If you have a chance to do it, do it.
Okay.
Yeah.
Okay, I would like to thank everyone who attended our session today, and all the thanks to Dr. Sarah Ahmed, our guest speaker for the day. Again, I put the information for our social media groups on the chat. If you would like to continue participating in these lectures or the upcoming workshop, please join our social media contacts or send me an email, call or text me. We will have all the information needed shortly. Thank you again. And if you want to say something, Dr. Sarah.
Actually, thank you for attending this. And one of the things that I don't have so far is a clear plan about how to go about this. So this is just a test run. And I would like to know your opinion on whether this is a good way of doing things or not. And this is just an introduction. Then if we have any future sessions, it should be focusing each session on one question or one thing about the interview. So that how the upcoming sessions will be. For example, next session should be around the question of what can you tell me about yourself, which is one of the very common or the commonest questions asked. So please tell Ines about how, don't tell me directly if you are shy. You can tell Ines how I did or how these things can improve or change. Thank you very much.
Thank you so much, Dr. Sarah. You did very good. You did excellent, actually.
Thank you.
Thank you so much, Dr. Sarah. Everybody's happy here, so you should do it for us, I guess.
Thank you so much.
Thank
Yeah.
you.
Thank you.
Thank you, ma'am. Thank you so much.
Thank you.
Thank you, ma'am.
You're
Thank you so much.
Dr. Sarah, if you want to go ahead and end the meetings, the meeting for all.
Okay. Now let me try to do it and not to mess it up.
Thank you so much.
Yeah.
Oh, thank you.
And